Hello, my name is Samuel Hahn, and I'm an assistant professor and therapeutic endoscopist at The Ohio State University. On behalf of my co-authors, and specifically the Consortium for the Study of Chronic Pancreatitis, Diabetes, and Pancreatic Cancer, it is my pleasure to talk about our study titled Utilization of Pancreatic Endotherapy in Patients with Chronic Pancreatitis, Results from a Multicenter Cohort Study in the United States. As our audience knows well, chronic pancreatitis can lead to pancreatic duct strictures and pancreatic duct stones, for which pancreatic endotherapy, or PET, can offer a potential treatment option. Prior studies have demonstrated high success rates in stricture resolution and stone clearance, but data on recurrence rates for pancreatic duct strictures and stones are limited, in addition to data regarding the timing of recurrence and risk factors for recurrence. Therefore, the aim of this study was to leverage a large multicenter cohort study in the United States to better understand the utilization of pancreatic endotherapy as well as its durability. Our study is a cross-sectional analysis of the PROCEED study, which is a NIH U01-funded multicenter longitudinal study including 9 sites in the United States that includes patients with chronic pancreatitis. In our study, we limited pancreatic endotherapy to ERCP for a pancreatic indication, such as abdominal pain, recurrent acute pancreatitis, or pancreatic duct strictures and/or stones. We excluded biliary ERCPs and also excluded therapeutic EUS procedures such as celiac plexus block or transmural pseudocyst drainage. We defined a treatment course as any number of PET procedures performed for the treatment of a specific indication, while treatment sessions were defined as each individual endoscopy performed as part of a treatment course. As you can see in this flowchart, our study had a total of 681 subjects with chronic pancreatitis, of which 295 did not receive any form of endotherapy. Of the 360 subjects who received endotherapy, a total of 238 subjects received pancreatic endotherapy for a pancreatic indication. Subjects who received pancreatic endotherapy were younger than those who were medically managed and also were diagnosed at an earlier age. They were also more likely to be female, have a lower income, lower education level, and higher rate of unemployment. Of those who received pancreatic endotherapy, only 8.4%, a minority, went to undergo surgery. Our multivariate logistic regression found that the odds of receiving pancreatic endotherapy were significantly greater in females, those with a lower education, and a lower income. We did find that if we adjusted the analysis to include smokers who quit within a year of starting pancreatic endotherapy as current smokers, smoking was also significantly associated with receiving PET. In terms of the timing of endotherapy, about 1/3 of subjects received pancreatic endotherapy in the same year as their diagnosis, with another third receiving pancreatic endotherapy within a year of being diagnosed. The median duration of the first course of endotherapy was 2 months, with a median of 2 treatment sessions. 62.7% of subjects had treatment response to their first course, while 22.9% had no treatment response. As you can see in this table, of the 238 subjects who did undergo pancreatic endotherapy, 43.3% received more than one treatment course, or repeat endotherapy. The median duration of the treatment course and the number of treatment sessions was generally consistent across treatment courses, with generally 1 to 2 years between treatment courses. Subjects who were unemployed had a significantly lower rate of repeat endotherapy, while subjects who had pancreatic duct stones in the head had a higher rate of repeat endotherapy. In summary, our study demonstrated that in the United States, in terms of tertiary centers, a high proportion of patients with chronic pancreatitis received pancreatic endotherapy during the course of their disease. Pancreatic endotherapy was performed more frequently in women and in those with lower education and lower income levels. Additionally, nearly half of subjects who underwent endotherapy needed additional treatment courses within 2 years after the initial treatment. We are excited to report the results of longitudinal follow-up in the future, and we hope to illuminate the risk factors for needing repeat endotherapy and describe the effects of endotherapy on patient-centered outcomes in chronic pancreatitis. Thank you very much.